What's happening? Today is Tuesday, January 17th. It is day 14 post-surgery, so this is going to be the last daily update that I provide, other than the 30-day and the 60 and the 90-day. I may do a quick one just on medications, share with you some of the stuff that I've done, a couple of the mistakes that we made along the way, show you some of the specific painkillers that they gave me. We made a change or two to the drugs along the way. Tried to actually sort of reduce, if you will, the amount of medication, specifically on the Tylenol side. I was taking a couple that were Tylenol based, but I may do one on that, as well as some fiber and other things that may help you along the way. But today is going to be quick and easy. So again, day 14, energy is great. My voice is coming back strong, feels much better. You'll see me, still struggle to swallow a little bit. That's going to be the case, I guess, for a while. At this point, I feel like I've got a pretty low grade sore throat. It's just kind of always there. One of the things that, we really as a family wanted to push for, and keep in mind, my wife is a doc and she's an orthopedic surgeon. The only reason I say that is being in that field, she deals with pain medications a lot, patients that are having to take them, so she knows what's going on there. One of the things that we're really pushing for this week is to, get me obviously off of that every 4 hour schedule I was on, which we have done, and get way back off of these narcotics and ultimately graduate to over-the-counter drugs by the end of the week. And, I'm pleased to tell you, just after a couple days, that's going great. It's going fantastic. So we kind of drew a line in the sand mentally on Saturday, which was the day that we had gone out of the house for a while. So Sunday, I started, I moved from 4 hours to every 8 hours. And I wanted to just push a little bit. I mean, I had the medication there if I needed it, but I was kind of starting to wonder, is this a system of habit, or is it truly because the pain is driving the need for the medication? And, you get on a regimen and your alarm goes off and you take these things and start to feel dry, sore, whatever. Well, I mean, I'm here to tell you, I was able to move this to 8 hour increments and cut my pain medication in half. And it's been great. I will tell you that I'm most sore during the night, so while I'm sleeping, is when I have the biggest challenge. And maybe it's because it's at the end of the day and you're resting and your body's restoring. You've been talking, or in my case, talking probably too much over the course of the day, etc. But that is going great, and I look forward to letting you know how that all shakes out on the 30-day update that's going to be around February 1st. Swelling is way down. I'm really not spitting up much grain stuff to speak of at this point. And so that's it on the medication. On the food side, slowly working my way back into to harder foods. Those little Hawaiian bread rolls. My 9-year-old daughter likes to make little sandwiches out of that. The bread is really soft. I've been able to do that, just some mayonnaise, turkey, something simple, straightforward. Takes a little while to get it down because you got to chew it, and it's got to be small enough to get past your throat and everything. So far, that's been great. So, back to eating eggs and oatmeal and had some cereal. I got to let it get soggy a little bit before I start putting that down there. But you'll see. Your body will tell you what you can do. Yesterday I was able to do quite a bit around here. I mean, I had a full day. We had picked up a recliner chair for the recovery. I was able, and which, comes apart into two pieces, thank God. I was able to move that from the upstairs to the downstairs, get all my medical equipment out of my bedroom and get that out of here. I do highly recommend using a humidifier. We live in Colorado where it's dry, but, nonetheless, you remember me talking about that nebulizer and the air device the medical air device that pushed it. That's gone now to the bedroom. They're coming to pick that up tomorrow morning. And, moving forward, I'm just going to use a humidifier to keep things cool. So, that's really it. Energy's good. Weight 237, so gained a pound. It's all, I think I've sort of hit the bottom and now it's going to be eating responsibly and getting back to the gym. I'm not going to be going back to the gym until February 1st. That'll put me I want to see the doc first of all, but that'll put me a full 30 days after, and then it'll be slow rolling back into some exercise, things like that. Be very careful not to overdo it. I will say that. As of today, today's the 14th, so I can take ibuprofen if need be. That's really up to you, obviously. I ran into a problem where I started to bleed a little bit. I had a blood clot, and the doctor thinks that it's very likely that came from my use of the ibuprofen. So, would I do it again? I would look back based on how scared that guy was and how scared he made me. With giving me we can take you to surgery right now, or you can get off the ibuprofen and we'll hope and pray that it works out. I would say I would have waited on the ibuprofen until day 14. So that's really it. I mean, things are in a good spot, feeling good, energy's up, and I'm ready to move on to the next phase. So if I have any other epiphanies, I'll certainly share them. I'll put together a little pain medication thing and just some of the things that I've taken that have helped, some of the fiber tools that we've used to help, keep things regular and keep your body healthy. And other than that, we'll see you around the 1st of February. Thanks again for your prayers and thoughts.